May is the Mental Health Month awareness, and today we're going to talk about addiction. So what is addiction? Addiction is an engagement of a behavior despite negative consequences. An individual keeps doing the same thing even though it's a bad idea. Addiction comes from a Latin word meaning to give into slavery. As a society, we don't understand addiction even though we call it a disease. Nobody explains why it's a disease. You hear most people saying, oh, people have a choice, or it's just a behavior. You need to have compassion to understand what is going on. When somebody with diabetes chooses to eat whatever they want and end up in coma and dies, we don't say that their children are better off without them. But when it comes to addiction, we are quick to say that their children are better without them. Awareness is not enough. We need to get people where they need to be. Neuroscience can be intimidating, but I'll try to explain. Even the brain expert don't understand the brain. In medicine, for a disease to qualify as a disease, it has to fit into the disease model. We have three parts: the organ, the defect, and the symptoms. For example, diabetes. The organ is the pancreas, the defect is the beta isolate cells, and the symptoms is the hyperglycemia, the kidney disease, and eye disease, etc. The defect is dysregulation of the reward system and decreased overall function of specific skills. We get symptoms such as loss of control and cravings. So how do you know if you are addicted? So you start noticing impairment in your function, such as academic success, professional success, in your relationship, physical health, or mental health. So what is the frontal cortex? The frontal cortex is part of the brain that makes you you. So what that means, your personality, your morality, your willpower, your responsibility, and your spirituality. The midbrain is subconscious. You have no control over it. It's the primitive function that keeps you alive. And the midbrain is only active when you are in danger. In most of us, our midbrain is asleep. To understand this, I'll give you an example of a research that was done on mice that were given cocaine. So the mice that gave themselves the cocaine or the frontal lobe did well, while those that gave themselves on the midbrain kept using until they died. These mice did not feed their kids, they did not eat, and completely forgot about their responsibility. So the research concluded that addiction has nothing to do with morals based on this research. For people who uses drugs, the frontal lobe is asleep while the midbrain is active. Another good example to help you understand the frontal cortex and the midbrain is supposedly you are stranded on the desert. When your frontal lobe shut down and your midbrain is active and you are stranded on a desert without water, if I come to you a week later and offered water, because your midbrain is very active, it keeps telling you, I need water, or I'm going to die. Like I said before, if you remember, the midbrain, it just tells you that your life is in danger. It's the primitive function. So it's trying to warn you that your life is in danger. Even if I come to you and say, okay, if you drink this water, you're going to lose your house, you're going to lose your job, you're going to lose your kids, you are more likely going to drink that water. So what happened next? So what will happen to that individual? They will go ahead and drink the water. And then after drinking the water, because now the midbrain has cooled down, and then the frontal lobe will start waking up, and then they will realize they just made a mistake. But again, it's too late, because the individual, that's when you start seeing people having shame, and then they'll start begging you, oh, sorry, I want my kids back, I want my house back, it was a mistake. But most of the time when it happens, it's too late. In a nutshell, addiction happens when there's changes in your brain. When you scan the person, you see activation in the midbrain and decreased activity in the frontal lobe. Since we cannot scan the brain of everybody that uses drugs, we always assume that everybody that uses drugs is an addict. So why is addiction a chronic disease? It takes up to 2 years to see normal activities on the brain for somebody who uses drugs. For those with addictive behavior or genes, when you are addicted to one drug, you are addicted to all of them. As you can see, addiction is a brain disease and has nothing to do with a specific drug. So what are the 4 neuroscience phases of addiction? The first phase is most people are using it for enjoyment. They want to have fun or feel better. There's no brain changes or habituation. The second phase, the brain starts to adapt. So there is habituation. The patient starts using over time. The third phase, you are screwed. You need the substance to feel normal. At this stage, you cannot function without the substance and it's difficult to stop. So there is dependency. So when you take drugs, you release certain chemicals. And one of the most common drugs that is released when we take drugs is called dopamine. Dopamine is also called a feel-good hormone. It gives people a sense of pleasure. So when you use drugs or any certain drugs, massive amount of dopamine is released. And what happens next is that the brain will try to compensate. And since the brain cannot handle massive amount of dopamine, it will start killing some of the receptors. Now you need more dopamine to get the same amount of pleasure. Now the threshold moves up and you cannot enjoy the same thing that used to make you happy. With phase 4, you have already developed the substance use disorder. That comes with anhedonia, which is inability to enjoy things that you used to enjoy. At this stage, if you get checked and they find out you have a brain tumor, oh, you get compassion. But if you get checked and they find out you have an addiction, then they just view it as a bad behavior. So how does addiction become a chronic disease? We all know 1 in 4 people that suffer from substance use have history of trauma. So what happened in trauma patient? In trauma, the body releases corticotropin releasing factors, CRF, which respond by taking away the dopamine. And we need dopamine to feel pleasure. And that's why most people who suffer from substance use end up using more and more to get that dopamine level to the level where they need, because they have lost it. So why people continue to use drugs over and over? Because for the first time, they feel pleasure. So why is it easy to relapse? Because when dopamine is released, glutamate follows. I'm going to explain this in a little details for your understanding. Glutamate is like the executive assistant of dopamine. It does write down everything that happened. So every time you take your drugs, the glutamate register that place, you register the pharmacy that you go to, you register the pharmacist who is wearing a white coat, you register the orange bottle that you're using, you register the injection and keep it in the file. When that happens, the brain does not know the difference. And this is why when we prescribe opioid for somebody who have been sober for years from alcohol, that triggers their relapse. Even though the patient may have been recovered from alcohol, any other drugs that is given would trigger the relapse, because the glutamate does not know the difference. It has just registered the dopamine that it gets from the drugs. And this is also another reason when patients come to the hospital after an overdose and you stabilize them, after they get better, you send them back home, and then a couple hours later they are back. The reason behind it is because the person, we send them back to the same environment that triggers them. The brain has not forgotten. So there's no way for that person to recover if we keep sending them back to the same environment that has caused them to have the addiction, because the brain still remembers. It has that memory. So we need to change the environment to help that person recover. Another reason that people relapse is the stress. As we talked about, most patients that use substance use have a history of trauma. So every time that CRF is released, it kills off all the dopamine receptors, and you need more pleasures, because, and you see that when patient comes to you, they always say, oh, my dog died, my wife left, all those stress factors will increase their relapse rate. The other drug use that increase the relapse rate is the pharmacy, is the other people they used with, is the environment, and that is why it is not good to become sober if your significant others is still using, because that will be a trigger for you. This is why we see good people turning into what we see. It has nothing to do with willpower. The good news is we have treatment. Counseling and coping skills will work on the frontal cortex while the medication work on the midbrain. So you cannot fix addiction without doing both counseling and medication. So what the medication does, it helps us stabilize the brain while we are working on the frontal cortex, while we are rebuilding those skills. You know that when you don't use those skills, they die off. So the medication will help us stabilize the brain while we are working on the coping skills. If we are unable to restore the cortex or coping skills, it doesn't matter how many medications we use. That patient is not going to recover, because we need to restore the cortex, to strengthen the cortex, because when we don't use it, we lose it. So we need to provide these people with coping skills, social support, safe environment, and spiritual support. Remember, punishment is not a solution for this individual. We all know it takes 2 years for the brain to recover. Even if you put them out in prison for 5 years and they come out in the society and a stressful event happens, such as losing their dogs, losing their significant other, or a wife leaving, they are going to relapse right away because they have not had the chance to work or strengthen their cortex. They don't have coping skills. I'm not going to go deeper into the neuroscience where we talk about other areas of the brain that get affected, such as the insula, the caprosecretory, and the PFC, and so forth. We'll get time to talk about it later on. Just know that you can absolutely recover from addiction. We just need to work on those areas of the brain. Make sure you have strengthened your cortex and also the midbrain. There are so many people who have recovered and now they are contributing members of the society. Since May is the Mental Health Awareness Month, I'll conclude saying that let's fight the stigma. Let's help those who were affected by the addiction. Looking for more suggestion on what you need to hear from me. Thank you.